Hey, it's Dave Brown here, host of Now with Dave Brown on AMI. Check out this latest highlight from the show. A new study shows the benefits of sports participation for people with intellectual disabilities. The study takes a particular focus on Special Olympics athletes and was published in the medical journals Social Psychiatry and Psychiatric Epidemiology. Here to share some of the findings is Dr. Meghann Lloyd. Dr. Lloyd is an associate professor at Ontario Tech University and the lead author of the report. Dr. Lloyd, thank you for making time for us today. We're grateful.
Thank you for having me.
So let's go right back to the beginning. What was the purpose of the study?
So my colleagues and I had been studying Special Olympics athletes for quite a long time, and we kept getting questions, but how do we know if Special Olympics athletes represent the broader population of people with intellectual and developmental disabilities? Because they participate in Special Olympics, and we know that physical activity is good for your health, maybe they're not the same as the general population who does not. So what we did was we partnered with Special Olympics Ontario and ICES, that houses the administrative health data in Ontario. And we linked registration data from Special Olympics Ontario to the ICES database. And that allowed us to answer questions about health, knowing who participated in Special Olympics and who did not. And this was a huge development in at least my research, in the sense that it's population level. We could have very large sample sizes and have very strong methods for studying different health variables.
So for a bit more context, how prevalent is depression amongst individuals with intellectual disabilities?
So the research indicates that it is more prevalent than the general population who does not have an intellectual or developmental disability. That's not to say it's every person, but it is more prevalent. And so any activities that may promote health, mental health included, or reduce the effects of this kind of health condition would be beneficial.
And I've got to stay with a little bit more in terms of the context here. What is the general consensus on physical activity and health and wellness?
So internationally, physical activity is good for your health. And there's also a dose-response relationship to physical activity. So the more physical activity you do, particularly at higher intensities, moderate to vigorous physical activity, the more the health benefit. The health benefit is not just physical health, because I think people probably are aware that physical activity is good for your cardiorespiratory health. It's good for strength and conditioning and your ability to partake in activities of daily living. But there is very strong evidence with many different studies broadly that physical activity is also good for your mental health. Now, all the mechanisms or the biochemistry in the brain as to why exercise promotes mental health is still very much under study. People are very much trying to figure that out. But the link is very clear in the general population.
One more methodology question for you. I'm sorry, I'm just a big fan of context and methodology. So when you collected all this data, what were you looking for specifically as comparison and contrast?
So that's a really important question, is that we actually didn't collect this data in the traditional sense of an experiment. We were using data that is already collected through the Ontario health system. And all that data, every time you swipe your health card and are diagnosed with the medical health records in Ontario, that data is collated and very private and very secure, but is available to researchers such as myself after extensive privacy and research ethics application to study it for research purposes. So it's called secondary data analysis. So this data already existed. What we did is we applied and then analyzed it in a very specific way. So we didn't collect any new data, which is what I do in my other hat when I'm doing my research. This is called secondary data analysis. Does that make sense?
It makes total sense to me. And Dr. Lloyd, you've been very patient with me as I walked through a lot of methodology here to sort of build a foundation. So let's get to the meat. What were the findings? What did you learn in going through this through the secondary data analysis?
So it's really exciting. So what we did is we started with a cohort of 19 to 29-year-olds who had intellectual or developmental disabilities in Ontario. And we followed them for up to 20 years. And we also had a look back period. So when we started this cohort, none of the participants in either group had a diagnosis of depression. So over the course of up to 20 years, the people who participated in Special Olympics had a 49% risk reduction in being diagnosed with clinical depression, compared to people who do not participate in Special Olympics who also have an intellectual or developmental disability. So this is a very significant finding. We also were able to control for other factors that may influence health or depression. So we controlled for where you live, how much physical or how much money or the socioeconomic status of the household. We can do that through census analysis. We also, through our method, we're controlling for age. We also controlled for overall health. We have a metric for overall morbidity, and we still found this 49% risk reduction, which gives us confidence that there is a health promoting effect to participating in Special Olympics for people with intellectual and developmental disabilities.
You mentioned before that perhaps there's more study needed here, and that's also one of the conclusions of this particular study. Where do you think the research could and should go from here?
That's the million-dollar question.
Oh. You can e-transfer me the money. That's perfect.
Yeah, great. So what we really do need to do is a prospective study where we might be able to control for more variables in real time in real life. So to do that, it would be, if you will, like a randomized clinical trial where we would enroll two groups of people and follow them for a long period of time, being able to account for things like access to services, access to health practitioners, social support systems, which we all know would promote mental health. And so in our study, because it was a secondary data analysis, we weren't able to control for those kinds of social variables that we do know have an impact on mental health. But it's very exciting. It's very promising because Special Olympics is relatively inexpensive in the grand scheme of health promotion. It already exists. It has extensive reach around the world. It's in every province and territory in Canada. And this is something that we don't have to start from scratch. We already know and have the infrastructure for it. So that is a viable path forward for people looking to promote mental health of themselves or their family members.
Yeah, you mentioned the reach and the grassroots connection that Special Olympics has in communities that then builds towards the elite level of competition as well. So looking at the findings and the data that you currently have and understanding that you do want to get more information, garner more information, learn more about this, how would you hope these current findings that you have might be used? What kind of prescription do you think they might be able to offer in the short term to organizations like Special Olympics or other parasports organizations?
One of the things that we talked a little bit about in the paper is this idea called social prescription. We know that people are more likely to follow through on a recommendation if it's given to them by either a healthcare provider or a professional who is providing services or some attribute of their life. So in other words, if your doctor tells you to go for a 30-minute walk every day, you're more likely to go for a 30-minute walk every day. So that's not to say that Special Olympics is the panacea for everybody, but it is maybe something that social service providers, doctors could at least bring up or broach with the people that they're serving. We also really hope that this might help people see Special Olympics in more than just sport context. So Special Olympics for many years now has been also providing health programming, health screenings, and referrals to healthcare providers in the community. And this health promotion aspect of Special Olympics, I think, doesn't get as much attention as their sport and competition side of what they do. And so greater awareness that being part of Special Olympics has the potential to improve your health is something that I think Special Olympics can run with. This evidence is quite strong, I would say. Yes, we need to do more research, but in addition to this, join Special Olympics, sign up for Special Olympics, I think it's an opportunity for the greater community at large to support Special Olympics. For example, either in signing up to be a volunteer, maybe a coach, maybe a referee or a technician, maybe it's lobbying or promoting with donors or the government for increased funding, because if there are more opportunities and more people who want to take part, that also requires infrastructure or quite honestly funding to run these kinds of programs. And so I think this provides preliminary but strong evidence that we can use to increase our capacity to serve adults with intellectual and developmental disabilities.
Dr. Lloyd, thank you so much for taking the time to share these findings, and thank you for all the work that you and your colleagues are doing with this research.
Thank you so much for having me. It was a pleasure.
That's Dr. Meghann Lloyd, an associate professor at Ontario Tech University. Do you want to dive into more conversations like this? Watch Now with Dave Brown weekdays at 9 a.m. Eastern on AMI-TV or download the podcasts wherever you listen. Do you want to dive into more conversations like this? Watch Now with Dave Brown weekdays at 9 a.m. Eastern on AMI-TV or download the podcasts wherever you listen.